there are actually relatively few what we call monogenetic causes of stroke. So that means that your parents have it, therefore you've got a high chance of having it. But what we're increasingly realising is that there are probably what we call polygenetic factors. So people often say, well, my dad and my grandfather had a stroke or a heart attack, and their uncle had a cause. And so there is probably some factor, not particularly that we can test for, not particularly that we've identified the gene for, but actually almost I would less focus on that. I would focus more on what you can do. So i.e. looking at your lifestyle, looking at the diet, making sure the blood pressure is controlled, making sure your sugars are well controlled, and treat the treatable. Because actually your genes are your genes, but you have to do everything else around it to try and, I guess, protect and prevent your further vascular health. As far as passing on to children, there are very, very few causes of genetically pass-on-able kids' strokes, and most of them are not. So it's more about you looking after your own vascular health in the ways we've discussed.